Okay, for the cardiac cycle, it has 4 phases, which is the first one is ventricular filling, the second one is isovolumetric contraction of ventricles, the third is ventricular ejection, and the last one is isovolumetric relaxation. All of these events in one cardiac cycle are completed in just 0.8 seconds. First one, ventricular filling. Ventricular filling consists of 3 parts. For the first one is when the ventricle expands, so the pressure will be dropped in the ventricle below the pressure in atria. This kind of situation will cause the AV valve to open and the blood will be flows into the ventricles. For the part 2, it is occur in 3 phases, which is the first phase is rapid ventricular filling, second part diastole continues in atria, where last phase is atriosystole, last part of ventricular filling. When it reaches the end diastolic volume of ventricles, or we call it as EDV, so the amount of blood contained in ventricles at the end of the ventricle filling will the same volume for the both ventricle, right and left ventricle. The volume of blood in about 130 ml in each ventricle at the end of the ventricular diastole.
Event of isovolumetric contraction. Atria repolarize and relax, then remain in systole for the rest of the cardiac cycle. Ventricles depolarize. This initiates the QRS complex. Depolarization followed by the contraction. AV valve close as ventricular blood pressure increase, then forcing blood to surge back against the AV cuts. Heart sounds S1 occurs at the beginning of this phase and closing of AV valve. Now entering the isovolumetric contraction phase. Ventricles contract but they do not eject blood. Why? Both AV and semilunar valve are still closed because pressure in the aorta and in pulmonary trunk is still greater than in the pressure in the 2 ventricles. Cardiocyte exert force, but with all 4 valves closed, the blood cannot go anywhere but rapid increase in pressure.
Events of ventricular ejection. Ejection of blood begins when the ventricular pressure exceeds arterial pressure and forces semilunar valves open. Pressure peaks in left ventricle at about 120 and 25 mm of mercury in the right ventricle. Blood spurts out of each ventricle rapidly at first with rapid ejection. Then it more slowly under reduced pressure, which is reduced ejection. Ventricular ejection lasts about 200 until 250 milliseconds and correspond to the plateau phase of the cardiocyte action potential. Stroke volume SV is about 70 ml of blood is ejected to the 130 ml in each ventricle. Ejection fraction of about 54%, as high as 90% in vigorous exercise. Long prolonged contraction of ventricle associated with slow calcium channel. The plateau of the myocardial action potential. And systolic volume ESV and 60 ml of blood left behind. T wave occur late in this phase.
Okay, the next one is isovolumetry relaxation. Early ventricular diastole or when T wave end and the ventricles begin to expand. The expansion will cause pressure to drop rapidly and suck blood into the ventricles. The blood from the aorta and pulmonary briefly flow backwards, filling the semilunar valve and closing the valve. Creates a slight pressure rebound that appears as the decrotic notch, which is a prominent and distinctive features of the pressure waveform in the central arteries of the aortic pressure curve. Heart sound S2 occurs as blood rebounds from the closed semilunar valve and the ventricle expands. Isovolumetric because semilunar valves are closed and AV valves have not yet opened, thus ventricles are therefore taking in no blood. When AV valves open, ventricular filling begins again.